Hypnosis is an effective way to access the subconscious mind and change unhelpful thought patterns. This can help people gain motivation, tap into their creativity, become more confident, and access happiness more easily. And these are just a few of the possibilities. But how do you use hypnosis to lose weight? Hi, I'm clinical hypnotherapist Dr. Steve G. Jones, and I'm here to share my knowledge of hypnosis with you to help you change your life. It doesn't matter who you are. If you're here to improve your life, I'm here for you. How to use hypnosis to lose weight is a mystery to so many people. I'm here to tell you it's all about understanding the simple mechanics behind it. I'm going to show you what the clinical research tells us about the factors that affect how hypnosis can help people lose weight. But first, let's look at why we should be concerned with how hypnosis helps people lose weight in the first place. If hypnosis is a viable treatment for weight loss, we first must determine the underpinnings for its success. The following factors have received attention as to why hypnotherapy is an effective weight loss solution. Research has identified a link between self-esteem and obesity. In fact, it's been found that low self-esteem in childhood can predict obesity as an adult. In a review of studies that explored the link between self-esteem and obesity in children and adolescents, 13 of those studies showed lower self-esteem was associated with obesity. However, one may question causality. In this case, they can only show that an association exists between self-esteem and obesity, not that one causes the other necessarily. The use of ego enhancement for ego strengthening is a technique frequently referred to in the hypnotic literature, although the exact suggestions that are used to promote ego enhancement are not always clear. As a researcher named Staffers points out, quote, ego strengthening comprises a set of standard suggestions aimed at augmenting the client's ego defenses, and general sense of self-worth, with the expectation that such an outcome will facilitate symptom relief, end quote. Additionally, he found 4 studies that supported the contention that hypnosis does help with self-esteem. In a study of obese women, a group of researchers utilized multiple hypnotic suggestions aimed at increasing self and body image. For example, one suggestion said, quote, it's okay and you are okay and your body can just do nothing but reflect the good flow inside and outside yourself, end quote. They found that groups that utilized hypnotherapy reduced weight and improved body concept. The researcher Levitt noted that ego-strengthening suggestions are often given as part of a hypnosis protocol aimed at increasing weight loss. Practically speaking, suggestions aimed to boost self-esteem can do little harm and may provide possible health benefits. Another aspect of hypnotherapy that aids in motivation as well as self-esteem is the use of imagery. Levitt noted that end result imagery, where someone pictures themselves after weight loss, appears to be effective. Picturing yourself as successful inspires confidence and motivates you to maintain weight loss behavior. Additionally, weight loss imagery overlaps with enhancing self-esteem since it causes you to feel good about the successful outcome. Let's talk about another way that hypnosis relates to weight loss, and we'll look at hypnosis for anxiety and stress. Anxious feelings and obesity appear to be related. Researchers have found a moderate level of evidence associating obesity and anxiety. Additionally, they have found that worrying in childhood was predictive of adult obesity. Hypnosis has often been touted as an effective treatment for anxiety among the general public. Because hypnosis is so often associated with relaxation and being calm, it's thought to be an ideal antidote to worry. Scientific research also supports that contention. A researcher named Golden found that cognitive hypnotherapy was at least as effective as behavioral therapy and cognitive behavioral therapy in the treatment of anxiety disorders. Research also shows support for the use of hypnosis in the treatment of social phobia, panic disorder, and generalized anxiety. The researcher Hammond concluded that hypnosis has been successful in treating anxiety-related disorders such as irritable bowel syndrome, test anxiety, and headaches. Stress has also been cited as being related to weight gain. It's not uncommon to hear people talk about stress eating. Stress eating is also supported by science. Chronic stress releases a chemical called cortisol. Researchers Scott, Melhorn, and Sakai found that stress promotes an, quote, anabolic state that promotes fat storage within visceral depots. In addition to that, stress appears to be linked to poor food choices, including food that is high in fat and sugar. These types of foods appear to reduce stress, reinforcing the desire for junk food during stressful moments. Unfortunately, stressful times are the norm for many. A quarter of Americans rate their stress level an 8 or more on a 10-point scale. At face value, hypnosis has validity as a stress reducer. It is seen as a calming process, and induction procedures often utilize relaxation exercises to produce a hypnotic state. Researchers have concluded that a majority of studies they reviewed reported a reduction in perceived stress when using hypnosis compared to control groups. Additionally, researchers have found that hypnosis that focuses on stress reduction is effective in weight loss, even more so than direct suggestions of weight loss behavior. The primary question that must be answered concerning hypnosis as a treatment for weight loss is, does it work? Unlike using some other areas of hypnotherapy, there is considerable research that has attempted to provide an answer to this. Milling and other researchers performed a meta-analysis of research measuring the impact of hypnosis on weight loss. They found a significant effect of hypnosis on weight loss, concluding the average person lost almost 7 pounds over 6 weeks. In addition, researchers Cochrane and Friesen found that group and individual hypnotherapy did lead to significant weight loss when compared to a control group. Stradling and other researchers also found that hypnotherapy resulted in statistically significant weight loss compared to baseline. However, not all research conclusions are as enthusiastic. A group of researchers in exploration of relevant research found only, quote, modest, end quote, effects, if any, when examining the effect of hypnosis on weight loss. I'd be remiss to consider the effectiveness of hypnosis on weight loss without reviewing the use of hypnosis as an adjunct treatment. In other words, along with another form of treatment. Although research has examined hypnosis as a lone intervention being used all by itself, many studies consider hypnosis to be part of a treatment protocol. Most often, this takes the form of adding hypnosis to a cognitive behavioral therapy intervention or as an addition to a simple educational/behavioral component. For example, researchers Biome and Sapp found that people who received a combination of hypnosis with CBT, cognitive behavioral therapy, lost significantly more weight when compared to a group that only received education in nutrition and exercise. In a review of research literature, Kirsch found that hypnosis significantly enhanced weight loss when used in conjunction with CBT. Other researchers, in contrast, found that hypnosis adds very little to what only CBT provides. Researcher Schoenberger gave a mixed review, stating that while the evidence is promising, it is plagued by, quote, methodological limitations, end quote. In a more recent analysis, Milling and other researchers found that hypnosis is most beneficial when used in conjunction with CBT. In fact, they concluded that hypnosis was significantly more effective when utilized together with CBT than either one was if used as a standalone intervention. In other words, hypnosis plus CBT is a more powerful combination for weight loss than just hypnosis or just CBT. One of the primary challenges with weight loss is that people often gain back the weight. Milling and other researchers noticed that individuals participating in a weight loss intervention usually gain back half the weight they lost after a year and almost all of it within 5 years. Any treatment that could produce better results would be considered invaluable. Fortunately, hypnosis research brings some reasons for promise. Cochrane and Friesen found that participants receiving hypnotherapy lost significantly more weight at a 6-month follow-up than they had in 1 month. Stradling and other researchers reported that hypnosis that focused on stress reduction led to a small but significant weight loss after 18 months. Other researchers performed a study in which the long-term effects of hypnosis on weight reduction were compared with a behavioral intervention. They found that only hypnosis led to an increase in weight loss at the 8-month and 2-year follow-ups. In fact, individuals did not just maintain their weight loss, they actually lost more weight at the 2-year mark than they had previously. If you want to experience hypnosis for weight loss, then head on over to thinandhappy.com and download the free 1-hour hypnosis audio that I've recorded. That's thinandhappy.com. Head on over there after this video. Now, let's talk about the use of self-hypnosis for weight loss. When research studies discuss using hypnosis as an intervention for weight loss, they are frequently talking about self-hypnosis. Self-hypnosis can be defined as participants performing hypnosis on themselves, usually after a period of practice with trained professionals. At times, they will be guided by a previously recorded audio. It is thought that self-hypnosis is a more practical intervention because most people do not have a hypnotherapist available during regular daily activities. Research has found that using self-hypnosis substantially increases the effectiveness of hypnotic interventions for weight loss. The same studies also suggest that hypnosis can be especially useful when dealing with chronic conditions such as obesity that require the use of hypnosis over long periods of time. Not all studies have found self-hypnosis as successful. Research that used self-hypnosis before meals did not find that it had a significant effect on weight loss. It was associated, however, with measures of increased satiety, people feeling more full and therefore eating less, also improved quality of life, and decreased inflammation. And I would say that people feeling more full and eating less would eventually lose weight. The great advantage of self-hypnosis is being able to use it whenever it's needed, after a person is initially trained, of course, in how to do it. This may alleviate the need to visit a hypnotherapist as frequently. When used correctly, it can be a highly powerful tool. The primary weakness of self-hypnosis is not knowing exactly how an individual is employing it. Research does not always specify how self-hypnosis is used, but it does assume that you're using it as instructed by a professional. The truth is that no one can be sure that people are using self-hypnosis correctly. For example, it is possible that someone using self-hypnosis is not actually achieving a hypnotic state, but is rather simply feeling relaxed. Therefore, the lack of reliability makes it difficult to figure out the effectiveness of self-hypnosis interventions. Let's talk about considerations for hypnosis as a weight loss treatment. Research has generally found positive effects when using hypnosis for losing weight, but it has also revealed the following issues. Although subjects in weight loss studies usually lose some weight, the reductions from hypnotic procedures do not always reach experimental significance. So, while participants may lose weight, it is not much beyond baseline levels. In addition to that, even when people lose a statistically significant amount of weight, it may not be clinically valuable. For example, while someone may lose 7 pounds over 6 weeks, that is not very much for an individual who's obese and needs to lose 50 or more pounds. Also, many of the hypnosis studies lack robust psychometric properties. In other words, the math may not quite be up to par. Unfortunately, this is not a challenge specific to hypnosis for weight loss literature. Much of hypnosis research lacks adequate levels of reliability and validity. The field is plagued by a lack of randomized control trials that do not hold up to scientific scrutiny. Research on hypnotic treatment for weight loss was popular in the 20th century. Since the turn of the century, there are only a handful of competent original studies that are not reviews of past research. Part of the issue is that hypnosis does not get as much respect as some other interventions. That is often why you see it used as an adjunct to CBT, cognitive behavioral therapy, and other treatments. Current research using randomized control trials is needed to support the validity of hypnosis as a treatment for weight loss. Having noted some of the challenging issues, it needs to be said that the hypnotic weight loss literature is some of the most promising in the field of hypnosis. There are multiple studies with good psychometric properties that point to its effectiveness, especially when used in conjunction with CBT. Particularly positive is the potential for hypnosis as an effective treatment for the maintenance of long-term weight loss. The ability to lose weight and keep it off has positive implications for many health conditions, including obesity, eating disorders, and diabetes. What's more, the public appears to believe in the potential of hypnosis as a weight loss treatment. Whatever questions remain about the research, it appears that a lot of people are turning to hypnosis to lose weight. They might be onto something. If you want to use hypnosis to lose weight, you're not alone. That's why I've created a free weight loss hypnosis MP3 download. Listen to it as you go to bed at night for 3 weeks and enjoy the changes. If you fall asleep while listening or skip a few nights, that's okay. Go to thinandhappy.com to download it now. You'll be glad you did. And there you have it. Now you've seen and heard the research on hypnosis for weight loss. It can help people lose weight. I've been using it to help clients for over 30 years, and I've lost 30 pounds doing it myself. Have you used hypnosis to lose weight? How did it go? Leave your thoughts in the comments below. I'm also interested to see if anyone knows someone who used hypnosis to lose weight. Thanks for watching.